What can be done about microvascular disease? Early diagnosis and treatment of microvascular disease is most rewarding in that it prevents the development of complications. Recommended treatment modalities include identifying and aggressively managing risk factors, regular exercise routine, healthy dietary patterns, pharmacotherapy, and nutraceuticals. Pharmacotherapy and nutraceuticals will be addressed in separate videos. Common medical problems and risk factors that could cause or contribute to microvascular disease include diabetes mellitus, hypertension, obesity, insulin resistance, sedentary lifestyle, and smoking. Effectively controlling the underlying disease process is essential in slowing or preventing progression of microvascular disease. Routine exercise. Aerobic exercise training is the most common healthy lifestyle change for improving cardiovascular function, especially in the elderly. Aerobic exercise improves endothelial function primarily by increasing nitric oxide bioavailability, lowering oxidative stress, and decreasing inflammation. To obtain optimum benefit of exercise, the recommended exercise regimen is at least 150 minutes per week of moderate intensity or 75 minutes per week of vigorous, intense aerobic exercise. Alternative, less intense exercises have also been found to be helpful, including bouts of exercise during the day to reduce sedentary time. Passive heat therapy, which mimics the acute cardiovascular response to traditional aerobic exercise like increased heart rate, peripheral vasodilation, and increased cardiac output, has also been found to have positive effects such as better nitric oxide bioavailability, decreased vascular resistance and autonomic tone, and decrease in systolic blood pressure. Healthy dietary patterns. 3 dietary patterns that have shown to positively impact microvascular health are calorie restriction diet, diet-induced weight loss, and dietary sodium restriction. Caloric restriction diet involves reducing total caloric intake by about 30 to 40% while maintaining an appropriate amount of micronutrient intake. Studies with mice placed on a caloric restriction diet for 8 weeks showed reversal of vascular endothelial dysfunction by increasing nitric oxide bioavailability and reducing oxidative stress. A lifelong caloric restriction diet can also prevent arterial stiffening, systolic blood pressure increases by preventing excessive oxidative stress, preserving nitric oxide bioavailability. Diet-induced weight loss requires consuming a diet for the purpose of decreasing body weight by 10%. It has been shown to improve endothelial function by decreasing oxidative stress. In addition, it can reduce arterial stiffness and systolic blood pressure by 7 to 8 millimeters of mercury. Dietary sodium restriction has been promoted as a strategy for reducing blood pressure and is an encouraged lifestyle change for those at increased risk of cardiovascular disease. In addition, dietary sodium restriction increases nitric oxide bioavailability by reducing excess oxidative stress-related suppression of endothelial function.